Hi friends, welcome to classes by Lab Doctor. I am Dr. Divya, and in today's class let us briefly understand about the treatment modalities for gout. Treatment differs from person to person. हर एक व्यक्ति के लिए ये जो गाउट का ट्रीटमेंट है वो अलग अलग होता है, बट द मेन एम और द मेन गोल ऑफ द ट्रीटमेंट विल बी सेम फॉर ईच पर्सन. फर्स्ट वन इज we want to reduce the pain. अगर there are attacks of gout or gouty flares, we want to reduce the pain. Second, we want to prevent the future flares. Future में ये gouty attacks आने से रोकना है. Third, we want to prevent and resolve the tophi to stop damage to your joints. We want the joints to be more mobile. We don't want any complications in the joint. We do not want the urate crystals to continue depositing. We do not want the crystals to damage your joints more. So we want to resolve the tophi. And also we want to care for other conditions or complications that happen with gout. For example, heart disease or kidney disease due to high uric acid. So these are the goals of the treatment. Now, just because you are having high uric acid, that does not mean that you will have gout, or all cases of hyperuricemia do not require treatment. So generally we will not give any treatment if the patient is having high uric acid, if it is more than 7 milligram per deciliter in males and if it is more than 6 milligram per deciliter in women, but the patient has no symptoms. If has no symptoms at all, then we do not give any treatment because it is not beneficial, neither is it cost effective. However, if a patient's का uric acid high है, if the uric acid level is high, we advise the patient to make some lifestyle changes, like it might be losing weight or their diet to consume less purine rich food like seafood, high fatty food, etc., to decrease the consumption of alcohol, to include exercise in their routine. So all this which will help them in lowering the uric acid levels. So now the treatment of gout is divided as acute treatment and prevention of recurrences. So now the acute treatment, whenever the patient is having an acute attack of gout, so that time there is severe pain, there is swelling, there is redness, patient has so much of pain that he just cannot move his leg. So in such cases there are many inflammatory mediators which are released, so we will have to give anti-inflammatory agents. It could be the painkillers or it could be the colchicine, which is again an anti-inflammatory drug. We have to use steroid, which is an anti-inflammatory. Maybe we will have to give it in the form of tablet or IV injections, or inside the joint also we might have to give some injections of steroids. That is the acute treatment. And then we have prevention of recurrences. That means we will have to prevent the attack of such kind of a gouty attack or acute flares. That means we will have to modify their risk factors. We might ask them to reduce the weight. We will ask them to reduce the weight. We will ask them to reduce alcohol, red meats, and certain diuretics like thiazides, etc. have to be very rationally used in them. We will give them uricosuric agents. We might give them xanthine oxidase inhibitors. So this gouty treatment depends upon the treatment of the attacks, as I've told you, anti-inflammatory, colchicine, steroids, tablets and others. And then the prevention is by uricostatic, uricosuric, and the drugs which are used to break down the uric acid. So this is an acute attack. Patient is having severe pain and there is so much of redness, stiffness in the joint, so we will have to rest the joint. Patient को rest करना पड़ेगा. He cannot move. He should keep his leg elevated. 2-3 पिल्लो लगा के उसको leg elevate करके रखना पड़ेगा. He should apply ice packs if the pain is very severe. We give them non-steroidal anti-inflammatory drugs like diclofenac, etc. We give them colchicine, which is an anti-inflammatory drug. Sometimes what happens, this the joint is very tense. There might be effusion also, so we might have to even aspirate and give intra-articular steroids also. Oral corticosteroids will be given. The sooner the treatment is started, the sooner the attack will subside. So this colchicine, it reduces the HSCRP or high sensitive CRP, which is an inflammatory marker. So this colchicine, what happens? It's an anti-mitotic drug. So what it will do? It will inhibit the tubulins and it will prevent the activation and degranulations of the neutrophils. So it will prevent the neutrophilic activation and degranulation, and hence the release of these inflammatory mediators which play a role in the acute attack of gout. That is why colchicine is given in the acute gouty attacks. The interval therapy, that means in between the attacks, we should see that patient concentrates on reducing the weight. He includes exercise. He reduces the amount of consumption of uric acid rich foods. He cuts down on alcohol. He eliminates diuretics, etc. And in chronic gout, we give certain drugs like uricosuric drugs. Uricosuric drugs are what? Which will increase the excretion of uric acid in the urine. For example, probenecid, sulfenpyrazone, etc. We will give the uricostatic drugs which prevents the formation of uric acid like allopurinol, etc., which will help in the blocking of xanthine oxidase. So it will prevent the formation of uric acid. And also we give certain drugs like rasburicase, etc., which will help in the breakdown of uric acid. So these are the drugs. Remember, when hypoxanthine is converted to xanthine and xanthine is converted to uric acid. So xanthine oxidase is an enzyme required for the conversion of hypoxanthine to xanthine. Allopurinol and febuxostat will inhibit the action of xanthine oxidase. So it is a uricostatic, prevents the production of uric acid. There are certain drugs like sulfenpyrazone and probenecid which will increase the renal excretion of uric acid. These are uricosuric drugs. And there are certain other drugs like rasburicase, etc., which will help in the breakdown of uric acid to make it more water soluble. So this is a probenecid tablet, this is allopurinol, this is rasburicase. So these drugs also help in reducing the uric acid levels in the body. But remember, this urate lowering drug should never be started before the acute attack has completely subsided. Agar patient is having an acute attack of gout, we should allow the acute attack to subside by giving him NSAIDs, by giving him steroids, by giving him colchicine. Only once it subsides, we should give the urate lowering medicines, because if during the attack only if we give the urate lowering drugs, it might exacerbate the condition. It might help again to trigger the acute attack of gout. We should never give this urate lowering drugs during an acute attack. So sometimes what happens, we might even have to do a surgery also, because I have told you in chronic tophaceous gout, this ulcerating tophi, they will fail to heal. The skin over the tophi will be very thinned out. It will ulcerate. There will be secondary infection, etc. So sometimes we might have to curate it. Sometimes we might have to remove the tophi, open and remove the tophi. Sometimes we might have to do the joint fusion, joint replacement also. So these are the surgical modalities of treatment. So remember, the treatment algorithm consists of acute attack and chronic attack. Acute is you rest the joint for 1 to 3 days, apply ice, elevate the leg, give it rest, review the medications, lifestyle, give the painkillers, colchicine and corticosteroids. And for chronic attack, we give uricostatic drugs like allopurinol, febuxostat. We give uricosuric drugs like probenecid, sulfenpyrazone, which excrete the uric acid in the urine, and uricolytic drugs like rasburicase, which helps in the breakdown of uric acid. Along with this, we will have to follow non-pharmacological treatment modalities also. We should avoid purine-rich food like meat, seafood, sweetened soft drinks, beer, alcohol. Restrict or avoid alcohol consumption. We should include exercise as a part of our daily routine. We should rest during the time of acute attacks. We should avoid medications which will decrease the excretion of uric acid in the urine, and patient should be always hydrated and try to have a healthy lifestyle. So these are the treatment modalities for gout. So thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.